Good evening to all the viewers who are watching live and will be watching on the recorded version. And so today it's 72nd or 73rd CME. I have no calculation currently, but we have many plans program means plotted, and we will present that to you sooner or later on our Instagram story, and the link is on the description for our Instagram page. So that's for the later part, and we'll talk about it on the later part of this CME. For now, let's just start today's CME with the 30 seconds countdown time.
Hello, good evening, everybody. And starting from day one, now we are on the 72nd episode. It's a long way journey, slowly reaching towards 75th. We are I'm missing my co-host, our beloved Kalyani sir, who happens to be the speaker for the fifth time in a series of documentations. And I am happy to have my co-host tonight, Dr. Pralay Sharma. But our moderator, on absence of our moderator, who Dr. Professor Partha Pratim Roy, who is facing technical glitch at Aurangabad, we had requested our beloved Dr. Pralay Sharma to moderate till Partha Pratim Roy sir joins us. With your permission, Dr. Pralay, let us bring upon on the screen our host tonight, Dr. Sumon.
Uh, uh, good evening, and I'm very happy to be here in this platform once again. And we have our scheduled CME right now, and we do have two of the speakers, very eminent speaker. By and by, they will be talking on the subject. And to inaugurate today's program, this CME, I'll request Dr. Sumon Kumar Biswas. Uh, He happens to be our ex-students of our institution, and right now he is a district health officer. And I will request Dr. Suman to inaugurate as well as to introduce yourself to the August gathering of this CME program. Hence, I request Dr. Suman to inaugurate today's CME.
Dr. Suman, please unmute.
Yes. So thank you, sir, giving me opportunity to speak in this session. So as sir said, to introduce myself first. So I'd like to introduce myself. I was a student of 22nd batch, National Institute of Homoeopathy, and I belong to Bangladesh. So once I graduated, I also pursued MPH, Masters of Public Health from Tata Institute of Social Sciences in Mumbai. Later, I went back to Dhaka and I worked there as a district health officer for maternal and newborn health care. And currently, I am pursuing MD homeopathy, and I have completed part on JSPS Government Homeopathic Medical College, Hyderabad. Now, I would like to thanks to this gathering. It's a great pleasure that I welcome you to all this esteemed gathering, the 72 online CME session organized by NIH Alumni Association. Today, we embark on a journey into the fascinating world of homeopathy, a therapeutic system that has captivated mind and hearts for the centuries. As many of you know, homeopathy is a holistic approach to healing that views the body, mind, and spirit as the interconnected whole. Our session today will be testament to the enduring legacy of homeopathy, where scientific exploration and empirical evidence converge. We have gathered here to exchange knowledge, delve into research breakthroughs, and engage thought-provoking discussion that will shape the future of homeopathic practice. Throughout this session, we will have privilege of listening distinguished experts in this field who have dedicated their lives to advancing homeopathy. The eminent speaker will enlighten us with their findings, shedding light into the latest development in the homeopathic research and clinical applications. Now, let me introduce the speaker of today's session. So our first speaker is Dr. Avijit Chakma. He is a research officer and scientist one at Central Council of Research in Homeopathy, CCRH. With extensive expertise in clinical research, Dr. Chakma has made significant contribution to various areas of his study, including the assessment of susceptibility, drug validation in chronic cough, clinical verification, and chronic kidney diseases. Dr. Chakma has been actively involved in the nodal officer for SC camp and previously for SRP camps, demonstrating his commitment to promote community health initiatives. He has also been responsible for handling IT and Hindi Rajbhasha related matters. In addition to his primary research and administrative role, Dr. Chakma has been involved in diverse tasks such as protocol preparation, overseeing the monthly reports for the all projects, organizing health camps, conducting CME programs, and horticulture initiatives. He has also been actively engaged in addressing outpatient and inpatient issues in the institute. Dr. Avijit Chakma's extensive experience and diverse range of responsibilities make him an excellent speaker for this session. Here, he can share his valuable insight and knowledge in the field of evidence-based medicine in the light of current research work. Our next speaker in this session is Dr. Narayan Kalyani sir. He is a highly skilled and respected professional in this field. He holds a BSc in biology and has completed his DMS from Calcutta University. He also holds a diploma degree from National Institute of Homeopathy and MD in homeopathy as well. He has authored 32 research papers related to homeopathy and health sciences. His work has been recognized internationally and he has been honored as an international research person. He and with an impressive professional history, Dr. Kalyani has held key position in prestigious institutions. He served as the former head of repertory at the National Institute of Homeopathy, Kolkata, and as an assistant professor at the Birbhum Vivekananda Homeopathic Medical College and Hospital. He has also served as an examiner for the West Bengal University of Health Sciences. In addition to his academic and research role, Dr. Kalyani has been actively involved in various associations and initiatives within the homeopathic community. He is the founder of National Institute of Homeopathy Alumni Association and the National Institute of Homeopathy Doctors and Research Association. He has also served as the former president of National Institute of Homeopathy Recreational Club. As the former nodal officer of National Institute of Homeopathy, he played a vital role in national campaign on maternal and child health by Ministry of Ayush, Government of India. Dr. Kalyani's expertise has been sought after globally, and he has presented paper and served as a speaker at several significant seminars, including those organized by WHO, this World Health Organization. And he has also participated in workshops, CMEs, and training for teachers, training for trainers, TOT courses. With his vast knowledge, research contribution, and extensive experience, Dr. Narayan Kalyani sir will undoubtedly provide valuable insight and perspective during this session. Now, let me introduce the moderator of this session, Professor Dr. Partha Pratim Rai. Sir, he is an esteemed moderator for today's session. Dr. Roy is an accomplished profession in homeopathy. Dr. Roy completed his BSMS from National Institute of Homeopathy, where he was a part of third batch BSMS. Following his undergraduate studies, he further expertise by obtaining MD degree. Currently, Dr. Roy serves as a valued member of Board of Studies at Maharashtra University of Health Sciences, Nashik. His involvement in shaping the curriculum for education standard ensures that he is up to date with latest development and trends in homeopathic field. With his extensive academic background and practical experiences, Dr. Roy is well equipped to moderate today's session. We are honored to have Dr. Roy as a moderator, and we are confident that his expertise will greatly enrich this session. And finally, I would like to express my sincere gratitude to the organizing committee, Bidyut Mukherjee sir, Prolay sir, Narayan Kalyani sir, and the dedicated researcher, and all those who have contributed to make this session possible. Thank you all. Then over to Partha Pratim sir. As maybe sir is having some network issue, so on behalf of Partha Pratim sir, Dr. Pola Sharma sir will moderate this session until sir joins.
Thank you so much, Sumon. And indeed, it's a good beginning. And I'm here today as a stopgap management. Uh, I'll be uh, I'll be there still the period the Partho joins. He might be some network issues. He is expected very soon. Uh, for the time being, let me act as a stopgap manager out here in the CME program. Without delaying, let me once again say a few words related to Dr. Avijit Chakma, as he will be the past speakers in today's session. And Dr. Chakma is a research officer in Central Research Council of Homeopathy. I've been in Tripura too, and I have seen Dr. Chakma to be clinician as well as research officer, and at the same time is a very good. He has very good skill in the research methodology. So whatever research across the country we do get, we get through the person like Dr. Avijit Chakma. And the research-based research is the need of this hour in connection with the homeopathy right now today. And that research has to be with evidence-based medicine. So our unique topic today, that's a rightly selected topic today, is the evidence-based medicine in the light of current research works. I believe that this session will go well, and I'll be there as a moderator till the period Dr. Partha Roy joins. Without delaying, let me call upon over the stage Dr. Avijit Chakma to deliver his speech. Dr. Chakma, please.
Uh, am I audible? Uh,
Yes, sir, you are
uh,
audible.
okay. Thank you all and good evening to all. Thank you, Dr. Pulay Sharma sir and Dr. Sumon for elaborate introduction about me. So, my topic is evidence-based medicine. Today's topic. What sir has said that today's need of the hour is evidence-based medicine. We need to show the result with evidence. So whatever we are doing, we have to show that result in through evidence, through our papers, through our manuscript, through our articles. So my topic is evidence-based medicine. So as sir said, I am working as a research officer in CCRH. So I think this part is very. So what do we mean by evidence? Evidence means available body of facts or information indicating whether a belief is true or valid, ground for belief or proof. Like somebody has deposited some money in your account, bank account, unless or until you are getting some statement, bank statement or some receipt, you are not believing that your money been deposited in your account. So this is the one type of proof. You need the evidence. Need of evidence. Evidence is used to prove an argument being made by individuals or groups that believe something to be true or a fact. There are lots of there are lots of evidences. There is not a single type of evidence. It comes in various different forms. Different kinds of evidence are associated with differing types of disciplines. Uh, Argo, can you make it larger? So reliable evidence should form basis of developing and changing individual programs. What happens the policy makers, they need some evidence, some documents to make some new policies. So this reliable evidence should form basis of developing and changing individual programs. It helps in policy guidance. Evidence supports assertion.
They need some evidence, some document
Evidence
to make some good policy. Uh, so this reliable for
Evidence provides analysis and data for the efficiency of our work. Evidence gives the opportunity to reflect on and suggest improvements to services. Evidence is for the providers as well as the users of services. Evidence and is used in the practice of prevention. So, type of evidence there may be indispensable, conclusive evidence, prima facie evidence, primary, secondary, direct, indirect evidences, even partial and extrinsic evidences. So, I am coming to the main point, that is evidence in medicine. Why we need the evidence in our practice of medicine? In the past, what happens? Doctors did not always have access to the latest medical research. They often decided how to treat patients using only their own judgment and experience and what they learned at medical school. Now we know that this is not the best way to practice medicine. This is because what doctors think is best for a patient is not always what the research shows is best. Means when researchers study a disease or a condition, they usually look at many more patients than any one doctor will ever treat. For example, Wilson disease, very rare case. So, whenever a researcher do some research work on Wilson disease, he needs at least 30 patients for that study. So, this rare case, a practitioner may have seen only one or two cases in his lifetime. So, a researcher always this research finding always helps us to get some evidences. Also, medical knowledge changes all the time. uh, Even in corona we have seen ICMR has changed lot of times their strategy, their protocol for treatment of corona patients. So this comes due to this research activities, and what doctors used to think was the best thing to do even a few years ago might actually be considered harmful today. So this is the changing pattern of our medicine. Only by looking at all the evidence and judging it fairly can you work out what the research really says about a treatment. This is called practicing evidence based medicine. So, evidence based medicine looks at all the research that there is about a disease or treatment. When researcher looks at whether a treatment works, they look at many more patients than a single doctor will ever treat. There is a difference between a practitioner and a researcher. So, why evidence from research is so important? For example, 50 years ago, women were often given an enema while they were in labor. This was very uncomfortable and unpleasant for the patient. Doctors thought that enemas would reduce the risk of infection for the woman and her baby. Some hospitals gave soapy enemas which were painful for women. So what happened with changing pattern? When doctors studied the results from the research, they found there was no evidence that enemas prevented infection. Two studies showed that enemas made more of a mess and women felt embraced by the enemas. Women no longer have enemas while they are in labor nowadays. Even in resting in bed used to be recommended for many disease conditions, but now we know that it can often do more harm than good. People who have a heart attack, for example, do better both physically and mentally if they begin exercising as soon as they get feel well enough. Even this removing the tonsil, removing children tonsils may not do them much good, and after a year or two they may have as many more sore throat as children who did not have their tonsil out, and some children get complications from tonsil surgery such as bleeding. Ideally, our doctor's treatment recommendation will be based on more reliable research available. So this is the outcome of research that now doctors should advise their treatment protocol as per the latest reliable research available. But it is very tough for a busy health professionals to keep up to date with advances in medical knowledge. We know we have lots of homeopaths who are very busy with their private practice. They may not have sufficient time to get through these sources, research studies. They need lots of time to go through these research papers. A doctor would have to read almost 17 articles in medical journals every day of the year to keep up with new information in their area of medicine. This number maybe could be even higher today. So, is it possible for a busy practitioner like I should name our Dr. Sunirmal Sarkar sir, LM Khan sir? They don't have much time to read all these papers. A doctor may be an expert in their field, or our doctor may decide how to treat you based on what other experts say. Much of what doctors learn at medical school is based on what experts think. Doctors like to ask their colleagues for advice. We are also, I am also attending patients in our OPD. Most of the time, in 50% cases, we generally prescribe medicine without going through the details or any research papers, starting any research papers like whatever Sir Pralay sir have shown us during our UG or PG time. Uh, we are just prescribing this some tonsil patient or some fever cases. We are just prescribing whatever sir has told us, but we have not examined whether it is really right or wrong. Sir has told, so we are just prescribing. So this is the time when we have to examine what sir has told. Is it right or wrong? But expert don't always get it right. It is safer to rely on the results of good research studies than on one person's opinion, because sir might have lots of experiences, and based upon that experience sir is imparting that knowledge to us. But we have to examine whether whatever sir is telling is it right or wrong. So what is the solution? Because uh, practitioner, they don't have much time to go through the uh, research papers. So what is the solution? So solution is uh, more medical information is now summarized to make it easier for doctors to keep up to date. Like in CME, we are organizing CME every year periodically for doctors, practitioners. So what happens in CME? Everybody knows that a doctor who is expert to coming to give lecture, he's summarizing, he's gathering all the information like in tonsillitis. He's gathering all the recent latest medical information about tonsillitis, and he's imparting that knowledge to a group of doctors. So this is one way of transforming the information at a large gathering. So CME is one of them. So we can even search in internet like PubMed, Google Scholar, etc. So components of evidence-based medicine. There are some three important angles: patient values and preferences, then clinical expertise, and best evidences like research outcomes, research papers. So we are considering all these three angles. Then it gives the evidence-based medicine. Practicing evidence-based medicine is important in today's healthcare environment because this model of care offers clinicians a way to achieve the triple aims of objective. What happens if we prescribe evidence-based medicine? If we practice evidence-based medicine, it will improve our quality, it will improve patient satisfaction, and obviously it will reduce the cost towards treatment. It also helps the organization establish a systematic approach to caring for patients with specific conditions. It also encourages a dialogue between patients and providers, so patient can share in the decision making and make their values and preferences known. Evidence-based medicine adding value to healthcare. How? Helps clinicians stay current on standardized evidence-based protocols. Uses near real-time data to make care decisions. Improves transparency, accountability, and value. Improves quality of care. Improves outcomes. So, what is the future of evidence-based medicine? There is an increasing need for clinicians to have access to the best available evidence to make the best possible decision to achieve the best possible outcomes. Clinician must practice evidence-based medicine. Patients will feel confident that they are getting the best care possible because treatments are based on the most current medical knowledge. Nowadays, many patients ask doctors about their disease condition because they are also getting the information from internet, from Wikipedia, from Google. They are getting, so they have curiosity, they ask the doctors. So if the doctors have sufficient knowledge, quality knowledge, even latest research out papers, that doctor gone through those papers, he must have sufficient knowledge, and he can impart, that doctor can impart that knowledge to the patient, and patient will get uh, proper treatment, as well as satisfaction will be there from patient side. Cost also decrease when care improves. It is the proportionate. When care improves, the cost will automatically reduce. Concerns such as avoidable readmissions can be averted when evidence medicine is incorporated into daily healthcare operations. So, I am coming to scientific uh, part of evidence-based medicine. Basically, there are 5 steps of evidence-based medicine. Step one is ask. Trip 5S. Number one is ask a clinical question. Number two, acquire the best evidence. Number three is appraise the evidence. Then four is apply the evidence. And step five is assess your performance. During our follow-ups, whatever outcome are there. So you can assess your outcome, assess your performances during follow-up of patients. So if we go through the research activities, if the Ministry of Ayush is maintaining a website, that is Ayush Research Portal. If you go through that portal, you can see that even in Ayurveda, there are almost more than 20,000 research papers. Whereas in our homeopathy, there are only 2,000 or 2,500 research papers. So there is a huge difference between our homeopathy and Ayurveda. They are much ahead in terms of research papers. There is a database, CAM database, complementary and alternative medicine database. If you go through that database, it maintaining the database of acupuncture, anthroposophy, Ayurveda, homeopathy, manual medicine, mind body medicine. So if you go through that website, there is around 351 research papers in Ayurveda, homeopathy 1803. Likewise, there is a home BREX, home basic research, actually home BREX. There is also around 2418 experiments. These are the actually databases. Home basic research, then home veterinary research. uh, it's showing around 476 studies on homeopathy and veterinary medicine. Another one is core home database. It contains around 1383 clinical studies on homeopathy. So now coming to homeopathy. Homeopathy is a pseudo scientific system of alternative medicine. It is written in Wikipedia. So most of us uh, very anguished with Wikipedia that it is written as pseudo scientific. Why they have written? But whatever Wikipedia have written, they have written that pseudo scientific, that word, based on some around 4 or 5 research words. You can refer those references. Concept about homeopathy. Then, what is science and pseudoscience? There, there are some differences between science and pseudoscience. Number one is, what science says is willingness to change with new evidence. Science is always changes. आज जो है वो कल दूसरा हो भी सकता है. एंड स्यूडो साइंस इज फिक्स आइडियाज. 100 साल पहले जो सोचा था आज वही फिक्स है. In terms of organ of medicine, if we think during Hahnemann time also, he has changed organ of medicine into different editions. So we don't have that fixed ideas. So we are also changing. Ruthless peer review. Science, every paper, every evidences, they have ruthless peer review, whereas in pseudoscience, they don't have any peer review. जैसे निकाला उसी तरह चल गया. Takes account of all new discoveries. जो साइंस होता है, it considers all the new discoveries, whereas in pseudoscience it selects only the favorable discoveries. हो सकता है कि वो 100 पेशेंट्स देखा होगा जिसमें से 90 पेशेंट्स का ही नेगेटिव रिजल्ट है, बट ही इज शोइंग द ओनली द पॉजिटिव. ओनली 10 पेशेंट जो ठीक हुआ उसी का पॉजिटिव दिखा रहा है. सो साइंस ऑलवेज इनवाइट्स क्रिटिसिज्म, whereas pseudoscience sees criticism as conspiracy. हम लोग भी कभी कभी सोचते हैं, मतलब पहले यूजी के टाइम में सोचते थे, कोई क्रिटिसिज्म कर रहा है तो हम लोग सोचते थे ये कॉन्स्पिरेसी हो रहा है अगेंस्ट होम्योपैथी. So this is not the thing. In science we should always invite criticism, और उसके लिए हमको why there is criticism we need to correct them. Science always verifiable results, whereas pseudoscience is non-repeatable results. Science limits claims of usefulness, whereas in pseudoscience claims of widespread usefulness. Science में accurate measurement होता है and pseudoscience ballpark measurement. So अभी the question is whether homeopathy is pseudoscience. Great, मतलब एक बहुत क्वेश्चन मार्क है. Most of us must be aware about this NSMRC report from Australia government, that there was no reliable evidence from research in humans that homeopathy was effective for treating any of the range of health conditions considered in 2015. So based on this report, they have stopped the funding for homeopathy also. Other countries, USA, UK, Germany, Russia, Israel, they have stopped funding for homeopathy. But in the other hand, the WHO is telling that homeopathy is the fastest growing and second most widely used system of medicine in the world. So there is a dilemma, choice of homeopathy, a dilemma, because few countries have stopped funding for homeopathy. They are telling that homeopathy is nothing but placebo, but sidewise, the WHO also telling that homeopathy is the second most important system. So here comes the role of evidence or evidence-based medicine. एविडेंस बेस्ड मेडिसिन सोचने के लिए जो उसका जो लेवल ऑफ एविडेंस, जैसे होता है ना कि स्टार मार्क, लेटर मार्क होता है, सिर्फ पास मार्क होता है, उसी तरह देयर इज अ लेवल ऑफ एविडेंस. If there is any systemic reviews and meta-analysis, it is the highest level of evidence. And after that, there is a randomized control trial. It is the second most important evidence. Then observational trials, then case series, case reports, oblique case experiments. So हम लोग जो case lots of case reports and case series is coming in various journals. When these are actually at the at the bottom of the level of evidence. So most important is meta-analysis, systematic reviews और meta-analysis. ये हमेशा कंपेयर करेगा इंडिविजुअलिस्ट होम्योपैथी वर्सेस प्लेसिबो. डबल ब्लाइंड रैंडमाइज पैरेलल आर्म ट्रायल होते हैं. पब्लिकेशन इन पेयर रिव्यूड इंडेक्स जर्नल. एक्सक्लूशन होता है ट्रायल्स ऑफ क्रॉसओवर डिजाइन, सिंगल ब्लाइंड ट्रायल, ट्रायल्स ऑफ होम्योपैथिक प्रोफाइलैक्सिस, एड ऑन होम्योपैथी. सो मेटा एनालिसिस में ये जो सिंगल ब्लाइंड ट्रायल्स होते हैं, दे आर नॉट कमिंग अंडर द परव्यू ऑफ मेटा एनालिसिस. Even prophylaxis like arsenic we have given in corona time, covid time, dengue we have given bryonia rustux. This prophylaxis homeopathic medicine will not come into meta analysis. Even add-on homeopathy, nowadays we are giving add-on homeopathy in cancer patient, in chronic kidney disease. So these type of studies will not come under the purview of meta analysis. So few of the important meta-analysis have been carried out by in the field of homeopathy. This is one of the meta-analysis by Methi, randomized placebo-controlled trials of individualized homeopathic treatment, systematic reviews and meta-analysis. And another by B. Sang A, 2005. So their findings are weak evidence for specific effect of homeopathy, strong evidence for specific effects of conventional medicine. Uh, in this meta-analysis, they have found that homeopathic medicines are not found very much effective, whereas conventional medicines were found to be effective with strong evidence. So ultimate result was the clinical effects of homeopathy are placebo effects. तो द लेवल ऑफ एविडेंस सबसे हाईएस्ट ऊपर में जो एविडेंस था दैट इज मेटा एनालिसिस और सिस्टमेटिक रिव्यूज. इन दिस स्टडीज what they have found that clinical effects of homeopathy are placebo effect. They are also telling that there is no difference between homeopathy and placebo. Then another meta-analysis by Kakat M in 2000. Here he found some evidence that homeopathic treatments are more effective than placebo. Strength of evidence is low because of low methodological quality of trials. Studies of high methodological quality were more likely to be negative. Another meta-analysis by Lindy K in 1997. In this study also, the combined uh, for the 89 studies was 2.45 in favor of homeopathy. This study showed that the clinical effects of homeopathy are completely not due to placebo. So first few meta-analysis, they have found that homeopathy is placebo. Homeopathy is nothing but placebo. In few of the meta-analysis studies, they have found that homeopathy is not absolutely placebo. It has some effects. Uh, there is a then we have some hippie furore type that homeopathy is not placebo, because last few meta-analysis showed that homeopathy is not placebo. So few studies show that homeopathy is not effective; it's placebo, and few studies show that homeopathy is not placebo; it is effective. So it is a very problematic for the policymaker. Tough time for the policymakers. What to do? So here comes the second level of evidence, that is randomized control trials. You must have known that DP Rastogi sir have done some research work on HIV trial in 1997. Here also he has shown that statistically significant difference in CD4 plus T counts in pre-post comparison in homeopathy group. Post mastectomy trial by Sorotrial L in 2017. There are also significant differences between homeopathic medicine and placebo. Arnica montana, 1000 K, could reduce post-operative blood and seroma collection in women undergoing unilateral total mastectomy. Multi-drug resistant tuberculosis trial by Chand KS in 2014. It is also showing that homeopathy has good effectiveness on this disease condition, multi-drug resistant tuberculosis. You can see the picture that before treatment and after treatment. First one is before treatment, advanced stage of my tuberculosis. After 1 year of treatment and almost 1 year and 6 months, the lung feel almost normal. There are psoriasis study by WIT CM. It is also showing that homeopathy medicine is more effective than placebo. So these randomized controls, whatever I have shown, they are all in favor of homeopathy. Then comes to the case series or reports. This is by George Vitolkas, 5 cases of gangrene. You can see the ABC photos before treatment, during and after treatment. Number last one below one, F number, it is after treatment. It is almost cured. Here also E number after treatment. So by this homeopathic treatment, actually in gangrene, what happens? Gangrene and it associated amputations are clinically challenging, but homeopathy offers therapy options. In this case series, 5 cases are presented in which the homeopathic treatment prevented amputation of a body part. So through homeopathy, they have prevented the amputation of that body parts, hands, legs. The aim was to show through case reports that homeopathic therapy can treat gangrene without amputating the gangrenous part and hence has a strong substitution for consideration in treating gangrene. It is one of my case report that homeopathic treatment of hepatic hemangioma with ovarian cyst. I have given pulsatile in this case. Uh, Initially, there was ovarian cyst along with hepatic hemangioma, and after treatment, the USG report was absolutely normal. Some case report by Khudabak sir in 2016. This is the scoliosis before and after 6 months. X-ray report also there. Bryonia chikungunya trial by CCRH. So all these case studies, case report have shown the effectiveness of homeopathy. Then Oscillococcinum in influenza. So whatever I have discussed, that case reports and this case study have effectiveness of homeopathy in these cases. Next, we have seen a lot of meta-analysis, randomized control trials from case studies, and that homeopathic is found to be effective in various disease conditions. But we need to report them in day-to-day practice. Lots of patients are getting relief from their disease condition, but it's not coming to actually in the real field that evidence. Many practitioners, they are seeing lots of psoriasis cases in their clinic, but rarely they are reporting those cases because there may be some uh, flaws. There may be some lack of knowledge, medical knowledge on how to write research papers. So here are the guidelines to write your research papers. Like if there is any meta-analysis systemic reviews, you can use the Prisma guidelines. Just type the Prisma guidelines in Google, it will come automatically. Prisma guidelines for systematic reviews and meta-analysis. Next is consort guidelines. It is for randomized control trials. Uh, I have discussed some randomized control trials. You can report uh, these outcomes, these findings through using the consort guidelines. Just type consort in Google, then Red Dot guidelines for reporting data on homeopathic treatments. It is one type of supplement to consort. Then there is STROP guidelines for observational studies. Then most important is what a clinician or practitioner can do in their practice, that care guidelines for case reports. They have lots of cases. They can report them through using these care guidelines. But if we go through the clinical cases of homeopathic cases, then they should use the home case guidelines specifically for these homeopathic clinical case reports. Uh, Earlier, I have said that I have told that the research studies should come from a reliable source, from a authentic source. The the sources must be authentic, uh, like where to publish your works. You have prepared a protocol. You have done your research. You have prepared your manuscript. Now, where to publish? Because you cannot just publish in newspaper or any journal. It is the wastage of your time and energy. So you need to look for some important journals. These are not predatory journals. They are very important. If you go through the homeobook.com, a compilation made by Professor Dr. Chaturbuja Nayak, Dr. Subhamay Ghosh, and Mansur Ali, Dr. Mansur Ali. These are the list of journals where you can publish your words, because they are all peer-reviewed journals. Your manuscript will go through a peer review process, so it has authenticity or reliability. So number one is homeopathy, then homeopathic links, then we have IGRS from CCRS part, and then International Journal of High Resolution Research, Complementary Therapy. These are the list of journals where you can publish your works. Another list prepared by Dr. Subranil Shah. He listed the journals according to uh, top top tier, mid tier, and low tier. Like journals, complementary therapies in medicine, complementary therapies in medicine, Journal of Integrative Medicine. These are comes in the top level of our peer-reviewed journals. In mid-level, we have our IGRS, Indian Journal of Research in Homeopathy, Homeopathic Links, then International Journal of High Dilution. So, just you can type list of peer-reviewed journals in homeopathy in Google. You will get this list of journals. These are few of my publications. This is on COVID, gallstone with prostatomegaly, head headache, ulcerative colitis, nails. So whatever I have discussed, it was to show that there are lots of controversy that homeopathy is not effective. But in contrast to that, we have lots of studies which showed that homeopathy has some effect which is not placebo. So accordingly, I have shown some evidences through some research paper. So here comes the role of evidence. So now the role of CCRS. What CCRS as a research organization, what is doing? The main objective is to generation of evidence from quality research works and dissemination of results of these works. Because every medical system has uh, three tools actually. One is clinical side, one is that research side, one is academic or teaching side. whatever we have studied during our UG, PG, we have learned from our teachers. We have seen the practical. We have practically seen lots of cases cured by homeopathy. But to validate those things that homeopathy works, homeopathy has effectiveness. To validate this, we have to go through some research. Only those papers we can show the policymakers that homeopathy has effects in various disease conditions. So this part is dissemination of results. This research work is going through our CCRH. As I already said, that medical system has clinical setup, teaching setup, research setup. So all these three things needs to be coordinated. So CCR is doing research in the field of clinical verification, clinical research on various disease conditions, like in our Agartala, we are doing clinical research on chronic kidney disease, then warts, psoriasis, etc. Drug probing is one of the research activities of CCRS, drug standardization, fundamental and collaborative research. There are lots of researchers going on with AIMS Delhi. Uh, then survey collection and cultivation of medicinal plants. In OT, we have that center. And public health program also. We have school health program, SCSP camps in SC dominated areas, epidemic research. We have done some chikungunya, that dengue, even in COVID, we have done lots of works. So we all need to bridge the gap between research and clinical practice. More use of evidence-based medicine, more success stories. As a team, we have to work uh, clinical care, research, and that academic. So with all this, I am summarizing. So this point is homeopathy long live with more research activities, with good quality teaching and clinical care. I hope the homeopathy will flourish more and more in coming days, because we are now generating lots of evidences nowadays. We are CCRS as well as even practitioners from NIH also, they are publishing lots of papers. So these are cumulatively uh, uh, producing lots of evidences in the field of homeopathy. Even I request those practitioners, even if they contribute 1% of their case reports, 1% of their cases as a publication, it will produce lots of lakhs of evidences in homeopathy. So I urge all the practitioners to contribute towards homeopathy, to uh, publish their words. It will cumulatively produce more evidences, and it will help the policymakers to decide on homeopathy on larger scale. Even we will get more fund in coming days. So homeopathy long live. With these few words, I am thanking all of you. uh, Thank you, Kalyani sir. Thank you, Pralay sir, Dr. Suman, and our Bidyut for organizing this periodical webinars, seminars through our NIH alumni. So I am concluding my speech here. Thank you all. Bidyuta, what to you?
Hello.
Yes, sir. Yes, sir. You are audible. Make make yourself unmute, sir. Unmute. Unmute करिए sir.
Hello, Biswas. Hello. Am I audible now?
Yes,
Yes,
Partha,
yes.
you are audible.
Hello, Dr. Avijit. You may
Yes.
remember me, myself, Dr. Roy Partha. I'm from third batch and NIH. I'm very sorry that I couldn't join because of huge network problem over my area. Otherwise, I'm the first person to enter to the studio. So what Avijit talked from his long experience with this research work on protocol and modules. So that is really the demand, and it is the demand of the time. And how Avijit, Dr. Avijit, how he had tried to explain the role of evidence-based medicine, and especially for homeopathy. So a very nice guideline he has given. And one thing that from this platform I want to share regarding homeopathic treatment in India, there are two sectors. One is a private sector and another is a government sector. The private sector in homeopathy is huge in India. Now the problem comes, those who are in academic level, they are only getting the touch of how to practice homeopathy and how to make homeopathy in a tabulated research form and pattern. So from this platform, I want to tell that all the practitioners, they should be more promoted, they should be more educated, by which they can write a research paper in a proper pattern and protocol. Because everyone has got their success in practice. But the problem is that the practice success remains in a square of his a chamber of his clinic, but that does not come out in front of the scientific world. So Avijit's guideline was fantastic. I think if he can share the two rays of slides where he had mentioned, because some of I also follow also this Prisma and this home case. So these are really very good media through which a person can understand the protocol and where to publish journals. So that is in a PDF form we can publish please in the NIH alumni group, so that from collected the group we can spread it in the common practitioners and to promote them to publish their paper in a proper pattern. So I am again sorry that I couldn't join from the very beginning of this CMA session. Now I am very much eager to listen from our beloved, our respected Kalyani sir, who is working tremendously for this alumni association, also with Dr. Bidyut, Dr. Pralada, Dr. Tridipda, all of our seniors. So Bidyut, please, I am now ready and I am eager to listen from degenerative joint diseases, especially of cervical spondylosis from Kalyani sir. Please. Hello, over to you, Bidyut. Hello, Bidyut. Sir, good evening, sir.
Good evening.
Good evening, sir.
Very
I
good evening.
was late to join, so I'll not waste your time. Please start your deliberation, sir.
Better late than never. Anyway, many thanks. Many thanks to Professor Partha Roy, Dr.
Sir,
Chakma,
sir.
Dr. Bidyut
Bidyut
Mukherjee, and
Mukherjee and
our
our
beloved
beloved
Sharma, on
on
screen and
screen
out
and
of
out of
screen, those
screen,
who are
those who are
viewing and
viewing
those
and
who will be
those who will
viewing.
be.
Thanks to
Thanks
all.
to all.
Now we
Now we
were
were
continuing
continuing
in
in
different
different
phases
phases.
the
The
experience of
experience of
degenerative joint
degenerative joint
disease in
disease
Nashik
in
to homeopathy OPD.
homeopathy.
Today,
Today is the fifth phase. Before that, let me tell you few cases. And
allow me to think about the cases. A person who are carrying some goods on his head under the scorching sun in this summer. Suddenly he fell down on the ground, on the road, and became unconscious. People ran to him. He was carried to the hospital. When he became conscious, he was asked what happened. What usually people ask. The person told, suddenly I started seeing dark pictures, giddiness. Then I don't know what has happened. Then people told, you've fallen down, you have been taken to the hospital. One case. Second case, at midnight, an elderly person was carried to the private hospital emergency department with the complaint that the person started suddenly pain in left chest. Tremendous pain. Patient is tossing about. He simply got up from the bed and started running here and there. Ultimately, we decided that it's a heart attack. We took him to the hospital. Private hospital immediately advised the patient, yes, this is a heart attack. He should be given immediately to ICU. The patient party was not that, was sound financially. They asked how much cost it will be if the patient goes to ICU. Then they were asked, we cannot tell you the condition of the patient. Condition is very serious. May cost lakhs of rupees. Patient immediately replies, sir, we don't have few thousand rupees also. Please leave us. Let us go to some other places. We will not be able to afford the fund. Anyway, by hardship, patient took the patient from the private hospital emergency department to government hospital emergency department. The doctors immediately saw the pulse, blood pressure, asked the patient, do you experiencing palpitation? Patient told, no, sir. Respiratory distress? No, sir. Does your pain were getting relief by lying down? Patients replied, no, sir. No relief of pain. The doctor gave one injection of painkiller, asked the patient to come next day morning in the OPD. This is not a case of emergency. You come to OPD for treatment. Just imagine if the patient could have been admitted in the private hospital, the poor person could have been beggar. Once he went to the government hospital, he was simply given one injection of painkiller, then he was asked to come in OPD, and with a few minutes, complaint goes off. That pain of left precordial area. Another case. Suddenly one midnight, patient party found that he was sleeping. Suddenly he got up from the bed and started shouting due to pain in upper abdomen. Mean thoracoabdominal junction in a band pattern like tremendous pain, dyspnea, not able to take proper breath. He was taken to the hospital. Similar way, first in the private hospital, huge amount was charged for the treatment. It was not affordable by the person, by the people. Then they went to the government hospital. They gave simple painkiller, asked few symptoms, checked the pulse, blood pressure, oxygen concentration, pain relieved, asked the patient to come in the OPD in the next morning. It is not a case of emergency. What are these cases? Those who have studied anatomy and physiology, they will be easily able to tell us that once the blood pressure, pulse, respiration, oxygen concentration is normal, it can never be a case of heart or brain disease. Right? All the cases were simply of cervical spondylosis. The doctors of the government hospital, they are quite expert, definitely. They ask the patient to come in the OPD because treatment is very simple. He needs physiotherapy and other orthopedic assistance for recovery of the complaints. This spondylitis is such a disease, though rare, but can create such a condition, emergency condition by which patient party and family members may be restless and seriously affected by the complaints. Today we will talk about experiences and the radiological cure of the cases in NIH OPD. In literature, all of us we have studied that spondylosis is neither a curable disease nor a controllable disease. It is simply manageable. Spondylitis is wear and tear of the joints of the vertebra and intervertebral spaces, vertebral disc. We know that it is a gift of modernization. Why the gift of modernization? Not gift, I should say the curse of modernization. We are trying to become modern day by day and forgetting normal physiology. We are forgetting gradually how to walk, how to sit properly physiologically, how to stand properly, how to study properly. Means properly means in the as per physiology says us. Whatever we are doing is exactly ignoring physiology, normalcy of the anatomy and physiology. When you lie on the bed, it is very soft. Our spinal cord gets abnormally bent by that soft bed, never remains as per it is. Means curvature of the spines are completely distorted when you lie on the soft bed, which you prefer most. When you sit on a sofa or a soft chair, curvature of the lumbar spine completely distorted. We cannot keep them in anatomical position. When we are walking reluctantly, our spinal cord is reluctant, not in anatomical positions. When anteriorly, convexity and concavity of the spine in different areas, cervical, lumbar, thoracic, and sacrum is not being maintained while we are walking. Same thing when we are studying, especially for the students. They do not know how to sit and how to study. They are bending their heads nearest to their subjects, book or khata. Hours together they are doing sums or writing answers or studying. They do not know how to read. That is why that is the only reason, due to ignorance and negligence, almost every family is having one or two patients of cervical spondylosis. In India, we will be astonished to know per year, 10 millions of people are newly suffering and becoming victim of spondylitis. This has become a common disease of elderly people. It is, although not very much serious, immediately never creates emergency. But as I told you, it can create emergency also. Why those pains on the precorded area? Because pectoral nerve usually is a branch of brachial plexus. So any compression on the root of the pectoral nerve root, cervical area, can create pain. And being nervous, the patient will be restless due to fear of death, and many of the complaints like heart attack will come, including perspiration. That unconscious state, fallen down and became unconscious, was due to spondylosis. He used to carry materials on his head but do not know how to carry. Blaming on the sun heat, we usually escape the complaints. But real complaint is he was having spondylosis while he was carrying the weight on his head. Normal curvature, normal root of the vertebral artery on the lateral aspect of the cervical vertebra are being tortured. Normal anatomical posture is disturbed by this spondylosis. Naturally, blood circulation in the cerebellum and the occipital area of the brain, posterior supply of the circle of Willis, getting blood with less amount naturally due to compression of the vertebral artery, due to distortion of the vertebral artery, blood quantity is going less in the posterior aspect of the circle of Willis, leading to hypoxic effect of cerebellum and occipital area of the cerebrum, which is the center of vision. Cerebral cortex is more sensitive than cerebellum, gray matter. Naturally, first patients experience dizziness, darkness, something moving around the eyes. That was due to hypoxic effect of the cerebellum, occipital area. Then there was vertigo, tilting. Patient could not control due to the weight on his head and falling down under the ground. And being nervous, he became unconscious, which is called a neurogenic shock, psychoneurogenic shock. And it is claimed to be an cerebral attack. So these problems are gradually increasing in number, as I told you. Only this anatomical structure of the skeleton is maintained in defense. If you see the Army, Navy, or Air Force people when they are walking, where they are sitting, when they are talking, when they are running, you will see the absolute anatomical position. They are trained likewise to keep the spine in anatomical position. Many of us already forget. We have forgotten that what is straight structure. Erected straight structure, we have forgotten. That is why our suffering. In addition to that, modernization, we have diet disorders. We are neglecting essential vitamins, minerals for bone and joints. We are indulging to the foods, beverages, and other things which are unhealthy for our system. Anyway, so this uncontrollable, incurable, so-called disease of spondylitis can be cured by homeopathy that we are going to present today in NIH OPD. Now let us consider to some extent how the spine looks like normal. Here is a picture of lumbar spine. I think it is visible. The first disc above is normal disc, equal depth of the intervertebral cartilage. The next disc is slightly distorted, that is degenerative disc. Third one is bulging of the disc. You see, towards the posterior spine, the disc is bulging. This is bulging. The fourth intervertebral space is herniation of the disc. Right? The disc has come out to some extent and putting pressure on the spinal cord. Next is thinning of the disc. Intervertebral disc is gradually become thinned out. Next is disc degeneration with osteophyte formation. The disc is degenerating, has become deformed. Along with that, for those reasons, marginal osteophytes of the vertebrae has started. You see, even this type of projection osteophytes has been developed. This has been shown progressive deterioration of spondylosis if we neglect, because spondylosis in the early stages do not have any indication. When we go to the physician, when patient asks for our help, it is already late, if not too late, but it is late. The very early symptoms of spondylitis, whether it is cervical or lumbar, the common symptoms are intermittent sprain. Suddenly, infrequently, or rarely, patient will complain that I get pain in my neck muscle, means posterior part of the neck muscle. Then automatically it goes off. By some warm application or by some massage, it goes off. Then again, after 1 and 2 months, there is another sprain. So this recurrence pain history is the first stage or early stage for detection of spondylosis that should not be neglected. Because at that time, our spine is simply it has started degenerating, early stages. It has started giving compression to the nerve roots. It has started giving irritation to the muscles, ligaments, by which the vertebral column is not being in anatomical position. Another early symptoms is irritation of mind, getting easily irritated. Was able to concentrate for a long period, but nowadays is not able to concentrate, especially for the students, college students and school students, getting easily irritable. Professionals, software professionals, fine work professional, they get easily tired and easily irritated. The reason is, as I told you, they are suffering from insufficient circulation, insufficient supply of blood to the circle of veins which supplies the brain due to the compression or irregular structure of the vertebral artery. Insufficiency of blood, little hypoxic effect. Early symptom of spondylitis is occasionally vertigo. For a second, then it is going off automatically. So this vertigo, irritation, easily tired, occasional sprain in the neck or lumbar areas, muscle spasm, muscle pain, are the early symptoms of spondylitis. If it is being neglected, usually people neglect these complaints by giving some warm application, doing this and that, they get sympathy, don't go to physician, they didn't have an X-ray. Naturally, that disease progress and progress and progress. Ultimately, the changes has been shown over here. Gradually, step by step, it comes to such a level that serious condition of the spine, then he goes to the physician, it is already late. It is another picture. This is another picture. Let me magnify. This is normal disc, first one. Then degenerated disc spaces, number 2. Number 3, herniation. As we saw before, the first picture, schematically, colored picture, this is radiological picture or X-ray picture. See how gradually the spinal cord is being compressed. Normal, it was normal. Diameter of the spinal cord was normal. When degeneration started, it became little narrow. When herniation started, it has become compressed, leading to various types of serious complaints. And that complaints will depend on which level has been compressed, how much it is compressed. As per a root value, that area will be affected and patient will complain of pain in this part. Lameness and soreness of the this muscle, this area. Particular area he will show in hands, fingers, leg, toes, thigh, as per root values. That all of us are well aware of it. Next, it has been given one scan picture, normal spinal cord, vertebral column. Now, this here how intervertebral disc is giving compression to the spinal cord, leading to various types of complaints. This is, as I was telling, the root values. Sciatic pain, pain in the posterior part of the leg. Occasional slight pain, getting relief by massage or doing this that is such a slight movement of the extremities, giving relief to the pain. This is the early stage of lumbar spondylosis. If it is being neglected, it is going gradually to the worst stage. See how the nerves are coming down. Before the knee, it is sciatic nerve. It is giving branches. And as per the compression area, the patient will complain that this area is under pain or numbness or soreness or tingling. Another indication of medium stage spondylitis is tingling of hands or legs or tingling of fingers or finger in hands and toes. That means remotest part of the nerve supply is in the early stage getting tingling sensation. That means that nerve root is not able to conduct the nerve impulses up to the physiological level. It is being disturbed by the little pressure. That's why it is giving some tingling sensation. That is another earlier, not if not very early, but early stage. That also should not be neglected. Here is one radiological structure. You see the L1, L2, L3, L4 vertebra, it has become straightened. L5 vertebra has become slipped in. So L4, L5, there is an irregular arrangement of the vertebra leading to compression of the nerves and giving severe pain. Here is one radiological picture. How osteophytes have been increased, how this diameter of the intervertebral disc spaces. This has become, posterior aspect has become very narrowed, entry is widened. These are the osteophytes. So it is getting compression. Here also there are changes, but this was normal. So these pictures I showed you. Here is another picture. See how the lumbar vertebra has become compressed, fourth and fifth. The axis has become deviated. See the lateral view, osteophytic changes, these degenerations, irregularities, slipping of the vertebrae, fourth and fifth, leading to various type of complaints. Here is another worst type of X-ray. If we neglect by giving some this medicine, that medicine, palliative drugs, ignoring constitutional drug, ignoring totality of symptoms, ignoring individualization, ultimately by giving doctors, biology, this and doctor, we are throwing the patient to a such type of serious condition. Gradually, the pathology will deteriorate, the structure will change very much abnormal, and ultimately your medicine will one day fail. He needs surgical interference and lifelong restriction of life. And he will be blamed throughout his life that due to negligence of that doctor, I have become crippled. Here is another picture. The compression, osteophytic changes, lumbar spondylosis. Here is cervical spine compressions. See the degeneration of the vertebrae, compressions, this area, make the larger one. See the changes. Straightening of the vertebra. Here is scan picture of the whole spine. See the abnormalities. This picture, these are the abnormal areas, cervical. Cervical vertebrae is not in anatomical apposition, not in normal curvature. This was supposed to be forwardly curved, that becomes straightened. Lumbar vertebra was also to be anteriorly convex, concave, posteriorly convex, that has become almost straightened. Here is another picture. See the osteophytic changes, sclerotic changes, disc degeneration. In dorsal vertebra too, there are changes, osteophytic changes and disc degeneration. Lumbar and lumbosacral areas, similar change of different type of pathologies leading to spondylosis. Here is another picture. See how the spine, dorsal spine has become bent and how big osteophytes, they are creating various types of complaints. Osteophytes in the early stage, I told you before, they usually do not create any complaints, simply occasional sprain and this that little complaint. But if it is being ignored, then patient is going to that extent. Here is another worst type of spinal cord, that's what vertebral column, due to advanced spondylosis. And if these stages are neglected, there are another serious disease called ankylosing spondylosis. Ultimately, this osteophytic changes goes on progressing, and ultimately vertebral body becomes fused to make one bamboo. It's called as bamboo spine, bamboo stick spine, due to ankylosing spondylosis, one of the worst case of delayed or neglected spondylosis. So these are the common few pictures I shown you. just to be convinced that how serious this spondylitis is, how easily we are neglecting. Now, before telling the symptoms of, before showing the documentation of cure, complete clinical cure of spondylosis with different types of pathology, let me tell you the some positive factors. As I told you, the modernization, diet disorders, and treatment by unskilled persons. Early symptoms, as I told you, that occasional pain, dizziness, occasional vertigo, weakness, tiredness easily, irritation is the early symptom. Late symptoms are, as per pathology is concerned, in the spine. Usually we'll find complaints of tingling in the hands, weakness of the hands, not able to catch hold of fine materials, then losing strength gradually, not able to catch hold of heavy things. Plus, the compulsory complaint will be tingling of the hands, especially when lying comfortably. Once the limbs is under pressure, when the patient is lying on his side, putting pressure on one limb, there is tingling. It is common because arterial supply has become reduced due to pressure. That's why hypoxic effect is giving tinglingness of the limbs. That is common. But when the patient is lying still, anatomical position, or normally without any compression, or freely hanging, or doing some normal common works, persistent tingling is a definite sign of spondylosis, either in the upper limbs or in the lower limbs. In addition to that, if we find vertigo, especially postural vertigo, patient is working in sitting position, suddenly he stand up and immediately he got vertigo, falling down. Or patient is lying down early in the morning, he is getting up by listening the alarm of the watch. Whenever he is getting up, he is getting vertigo. This postural vertigo is one of the confirmed signs of cervical spondylitis. The tingling of the limbs, postural vertigo, is confirmed sign of spondylitis in a moderate stage, if not very advanced stage. Immediately, the steps should be taken for treatment. For lower limbs, same complaints like upper limb means brachial plexus, lumbosacral plexus, there will be tingling, weakness, occasional cramp in the muscles, lameness, soreness, rarely burning, tingling of single finger, single toe, or entire foot, or below the knee, or the entire leg. That depends, as I told you, compression on the nerve root area. In lumbar spine, there is a severe complaint that is called as sciatic pain. Many people do not know what is sciatic pain. It is simply due to spondylosis. The lumbosacral vertebrae, which is especially lumbar vertebrae, they have been degenerated. Nerve roots are under compression. That is why they are trying to get rid of this compression. That is sciatic pain. And it is such a type of pain. Those who have experienced, will be able to tell you tremendous pain. The patient will start crying, so much pain, and not getting relief by anything. Plus, weakness of the limbs. These are the moderate or to some extent advanced stages of cervical spondylitis. Now, patient will come to us in cervical and lumbar area. Tremendous pain, excruciating pain, not able to sleep. A little motion causes tremendous pain, catch pain, like stabbing in the spine. Ask the patient to sit straight, erect, in anatomical posture, in a firm sit. Then ask the patient to cough, or ask the patient to sit erect, put your one palm openly on the vertex, and give a fist, a blow on your palm. If that pain radiates to cervical or lumbar vertebral area, giving a sensation of stabbing like pain, patient will suddenly shout due to a stroke on the vertex. It is sure that nerve is seriously compressed. Case is very serious. That is vertex thrust. Another is root pain and girdle pain. Ask the patient to sit erect, keeping the lumbar spine and thoracic cervical straight anatomically. Ask the patient to cough a little bit loudly. Immediately, patient will ask tremendous pain due to cough. Ask the patient to locate by tip of your one finger. Patient will locate the exact point of lesion where compression is. Ask the patient to go round, means show the back and show the point. He will show by tip of the finger which area got the stabbing pain. This is called root pain. Another pain, when you are asking to cough by erect posture, tremendous pain starting from the lumbar area to umbilicus in a band-like pattern. Sparking pain from the dorsal area, vertebra, to the umbilicus or below the umbilicus. This is called girdle pain. That is more serious condition. Spinal nerves are so much compressed that entire nerve path has become sensitive, giving tremendous pain. These are very advanced stages of spondylitis. Immediately they must be taken very serious measurements, medications for recovery. Usually these patients with girdle and root pains, if does not get relief by painkillers or some conventional drugs, they are asked for operation, replacement of the vertebra or intervertebral disc synthetically, or placing of supports, metal supports in vertebral column. This is a severe operation. Plus, restriction of movement of life. In these cases also we have seen homeopathy has a nice reply. Along with certain physiological conditions, the patient should not be allowed to bend forward because lumbar vertebra compression that will increase if the patient bends forward. Naturally, the pathology will aggravate, complaints will aggravate. So, restriction of movement forward should be completely restricted either by the belt or patient. If patient is careful, he listens to our advices that he should ask not even to take one mug of water from floor and never to lie on soft bed, never to be reluctant while sleeping, lying, sleeping, sitting or walking. Try to keep the spinal cord straight like military persons. Then your case taking, constitutional drug, etc. Now, is spondylosis is curable? I told you, Degenerative says it is not curable. We have heard enough regarding placebo effect of homeopathy. But I will tell you one incident. Health Minister, immediately I cannot recall his name, Dr. Ambubani Ramadas, something like that. At that time, Arogya was in Delhi, New Delhi. I was there. So, Ambubani Ramadas, he was inaugurating the program. In the opening, at that time, in Lancet, there was one article that homeopathy is a placebo effect. So, he is telling minister that taking responsibility, I am telling the person who has printed this in the international journal. You please come to India by our expenditure, come to our OPDs, see cures and recoveries, change your ideas by our costing. This was his confidence. He was a doctor of modern medicine. Still today, every one of us must have that confidence. Whoever is shouting placebo, 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 let them shout. But the number of people in the whole world is gradually accepting this system of medicine as second option of therapeutic system, as it is told in WHO. So, brothers and sisters, I just recall one thing, that if anything grows very rapidly and without any cost effectiveness, without much financial benefit, usually there will be persons who will start shouting because they are facing problems. That's why they are telling placebo effect. This is not today, not that this and that journal has published. It was since starting of homeopathy, for which Handyman was tortured like anything. Can any of us imagine that I may have to leave India and I have to go some other countries to live simply to survive, being already separate and to love this homeopathy system medicine? It was Handyman. So this torture, criticism, this and that thing, placebo, all allowed people to start shouting. But the result is more they are shouting, more number of people are taking homeopathy medicine. More number of patients are increasing in our OPDs and IPDs. So we should not be little disturbed, even little disturbed by their criticism. As I told you before, it is cultivation of science. A group of 11 scientists, they are telling that physics has not yet reached to that extent to prove that how alcohol molecules, how water molecules, how sugar of milk molecules are carrying properties of some other materials, not silica or a metal, etc. So what these people will tell? Science has not yet reached to that extent that how one molecule is carrying properties of other molecules without any structural change. Anyway, these are common things. The more it will be criticized, we started from Chakma right now that science invites criticism. So more will be criticized, more will be proud of the criticism, more people will come to us, they will get the result, and homeopathy will progress in spite of all evil forces in the world. That is progressing. Now let me see, just to encourage you all, that I will show you 13 cases with 91 documentations. It may take a little bit of time. If time does not provide, then we will be able to see it later on. See one patient, lateral view of lumbar spine. All of our OPD. He was able to see the vertebral columns of this area. It has become compressed and irregular area. Before treatment, see the report. Make me a larger one. You are able to see the different types of changes, osteophytes, then reduce posterior disc spaces. Okay. Let us see what happens after treatment. Treatment started. You are seeing the gap has become a little bit prominent. Lateral view. Are you able to see? Normal study of A spine. Okay. Next. Another patient of cervical spondylosis. Lateral view. The changes are very distinct. Curvature is lost. IBD has become reduced. Here is the picture. Sharpened articular facet, C4 to C6, loss of lordosis, spondylosis. Next picture, distance has increased, curvature has become to some extent normal. Anterior posterior view. Still there is spondylosis. Treatment continued. Loss of lordosis, relatively reduced disc spaces, lumbar cervical. Treatment is continued. Normal study of cervical spine. So before treatment, during treatment, after treatment. Cervical spine become normal. Lumbar spine become spondylosis at L4, L5 level only. The rest of the pathology has gone off. Another picture, sharpened articular facet, AP view, lateral view, normal appearance of the cervical spine. Clear? None of the reports are given by any homeopaths. All the reports have been signed and certified by radiologists of Nashik Homeopathy outpatient department. So we are not claiming. Radiology department, radiologists, and X-ray plates are claiming that homeopathy medicines can cure spondylosis. Another picture, reports. Okay. Next, after treatment. Still it is there, sharpened articular facet between the treatments. Normal study of cervical spine. So before treatment, during treatment, after treatment. You will be astonished to know that cervical ribs, that also can be cured. I will try to show you in these reports. See the reports before the treatment. Lumbar spine, minimal posterior subluxation, sharpened articular fascia in the cervical spines. Next plates. Report is a normal study. Okay. Let me find one more thing. See what I was telling you. See this point. First line. Rudimentary cervical rib. Okay. It is congenital disease. That is also getting cured with spondylosis. Just a minute. I am not very much expert. That way I have to say it again. See. So cervical, everything became normal. That means rudimentary cervical rib, which is claimed to be completely incurable, it will remain throughout his patient's life. That is also becoming normal, not visible. See the beauty of homeopathy. Next case, lumbar spine, epilateral, lumbar spondylosis. AP view, lateral view. Other pathological condition has gone off. Simply reduce this space is still there. Normal study. Next case, AP view, lateral view, cervical lumbar, both sides spondylosis. After treatment, cervical spine has become normal. Cervical spine normal study. Mild posterior subluxation is still there up to L5 and S1. This space has become normal. Rest of the components of the lumbar spine has also gone off. Cervical has become normal. Lumbar spine, next case. Spondylosis, both lumbar and cervical. Lumbar has become normal. Lumbar spine normal study. Simply loss of lordosis, likely from back muscles. It is being shown. Why this is remaining? Because patient is curing pathological lesions, osteophytes, other pathology of the bones and joints has completely gone off, become normal. But still then, muscles are not able to be in the normal position. Still then, muscles are under contraction spasm because for a long period, muscles and ligament had to be contracted forcefully to prevent persistent friction between the vertebrae, to keep the patient comfortable, to relieve, to reduce the compression of the nerve roots. That is why after pathological complete cure, for a certain period, for a very short period, patient will go on complaining of little pain in the low back pain. But X-ray is telling there is muscle spasm, no bony changes. This will automatically go off. If you give placebo or anything, or if you do not give any medicine, that will go automatically. The muscle cell ligament will adjust their normal structures. So one more thing I like to tell you from Dr. S.P. Day, and I have also having the experiences and the evidences also. I had one case of dengue and few cases of malaria. Report become negative. Patient is complaining of fever and weakness. Intermittent fever is continuing for malaria. Report has become negative. Patients are still under fever in dengue. I learned it from Dr. S.P. Day. Many of you might have heard his name, senior specialist. He used to tell that in homeopathic treatment, pathology will first go, complaints will remain, they will go later. Because the complaints are to sustain the normal physiology. So after getting rid of the pathology, as per habit, the system, physiology, continues the complaints to prevent from further deterioration. Ultimately, those things will automatically go off. That means if you find malaria blood picture is normal, if you find dengue blood picture is normal, be sure that patient has got cured. If you give any medicine or placebo, that patient will be automatically normal. That is as Dr. Chakma was telling, that this evidence-based reports are very much important. If we can, if altogether we can produce few hundreds of these radiological cures, anybody in this world, he is bound to bow down his head that we do not know what is homeopathy, but homeopathy can cure disease. You see, the cervical spine became normal. Clear? Lumbar cervical both became normal. and the lumbar spondylitis. Normal study. First we found cervical normal, then we are finding lumbar normal. Let me go back. See this case, cervical spine became normal, neck be enlarged, cervical spine is normal, clear, relatively reduced posterior displaced lumbar spine is still there, but after a few days of further treatment, we found normal study of lumbar spine. The cervical spine first became normal, then lumbar spine. And the report of cervical spondylosis. The pictures is clearly showing the spondylosis. See the anti-osteophytic changes, C4, C5. Normal study. I think it is very visible. Let me make you a little bit enlarged. These reports were done from outside. Now it is visible. Anti-osteophytes are seen from C4 to C5. Pedicles, interpedicular disc spaces, spines are normal. So this cervical spine or cervical spondylitis is getting cured. Another case of cervical spine. This is a report. Cervical lumbar spine both are affected. Cervical spine normal, lumbar spine normal. And if you see the period, time is very short. All documents will be in the YouTube. If you see the period of time, period taken for complete cure, you'll be astonished to know the tenure of these changes to normal. Another case, cervical lumbar normal study. Lumbar spine, cervical normal study. That means both cervical lumbars are becoming normal. Last time, before leaving the patient from OPD, both report become absolutely normal. What I do usually, you also try to practice this. After getting radiological cure, there may be a query that does it relapses after a few times? To ask the patient to come after a few months and with the X-ray report to see there is no chance of any relapse. Another case, lumbar and cervical spondylosis. Both are normal, cervical lumbar spondylosis. So these are the documentations. As Dr. Chakma was telling, minimum 30 cases should be there. So I presented 30. Many of you might be having 4, 5, 6 or 10, 15 cases. All together, we'll try to produce before the scientific world that homeopathy can obviously not only symptomatically cure the disease, but also pathologically, radiologically can completely cure spinal cord. This is the beauty of homeopathy. With this, thank you very much for providing me the chance to present these things. It is a long procedure because what I want to convince you that without having any infrastructure, simply by collecting OPD cases, we are able to show these changes. So if altogether, even individually in different places, if we go on trying and keeping documentation of radiological cure of bone diseases, definitely the world will see the mystery of homeopathy. Thank you very much.
This is not a answer that is given from NIH alumni. This is a great chance that we are listening to you. We are listening to you for 3 weeks, almost 3 times to the series of cases. The unincurables become curables. So it's a tremendous experience for the viewers and especially the old students of you, sir, to learn and to refresh the types and how to treat the disease conditions. Really remarkable, really remarkable. So I'm a very small person to judge it, but it's really tremendous. It's really tremendous. So, so probably there will be a question answer session. Sir, I want to ask a question from my side to the minister. Yeah,
Sure,
time
sure.
duration. How much average time duration is taken to conduct the patient to minister?
Okay, that I will try to show in the next session. The shortest and
Okay,
longest period, that was the astonishing information. Next CME
okay,
session, I will show the time taken. But for
okay, sir.
these
Okay,
cases, what I told you, all the times are mentioned above.
okay,
Before
sir.
treatment, during treatment, after. If anybody observe the dates, then it will be easy to see the duration taken.
Yes,
But
yes,
never
sir.
it was very
Actually,
long,
problem,
as it is called to be homeopathy, it
actually,
takes
problem
much time.
for me happened.
Uh,
That today I am sitting for 3 or 4 days with mobile phone only. So the briefing is late.
no problem.
Next time I will see in
Later you will
YouTube
see,
channel and then I will
you
get
see
idea.
what in laptop, then you will get idea. In next session, I will
The
also show
laptop it shows
the
bigger
minimum
screen.
and maximum duration.
Okay, sir. Okay. Okay, so fantastic session from Kalyani sir, our beloved, our respected sir, and from Avijit. A lot of things we have get to know. And now it is over to Bidyut. Bidyut, please. Hello, Bidyut, please take over the chat.
Please hold on a minute. Father will be coming soon due to some
Oh,
technical
sorry, the
issues.
name of the minister was Ambubani Ramadas, Indian
Uh,
Minister of
Okay,
Health and Family Welfare.
okay,
Dr.
sir.
Ambubani Ramadas. He
Okay,
was so shouting and very much encouraged. He was loudly, tremendous voice. Like, please come and see India and our OPDs and change your views in our cost. He was so
yes,
much confident, being a person of modern science.
yes, 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 yes. No doubt.
please
Probably
just
there is
Hello,
some
Bidyut.
network problem.
you all just continue. Father will be joining soon. You just all continue for
Okay,
now.
okay,
Yes,
okay,
that
no
is from
problem.
Orca. I find Orco is there.
No problem. Our main target is to encourage every one of us to keep documentations. Whatever may be
Keep
the case,
talking.
keep a
Exactly.
report. That will
Exactly.
encourage all of us. And by this
Keep
way,
all the
if we can correct
documentation
number of patients,
and to present
any
it to
case, keep
public.
document. Exactly.
Unless it is done, the scientific picture of the question, our system will be
Uh,
always in question.
and we need not to do anything to convince them. Simply show the reports. It is their
Yes, sir.
reports, not ours.
Yes. So Vidyuta is there to
And one
continue.
more thing, I like to tell you, I will show you in the next session. All the cases were given individual drug. Not even a single case was given by simply totality of the symptoms. All the cases.
Fantastic.
And I had one trial. I had one trial to see about 300 cases whether these hot drugs can cure this spondylitis or not. So there I found only very little, about 30% cases got palliation None of them are cured. Not even a single case was found radiologically normal. But the cases I get about more than few hundreds. Constitutional drug means symptomatic drug. Massively,
And
about 85 to 90% are getting clinical relief completely. And many are getting radiological relief, means radiological normalcy. The greatest constraints are patients are poor, they are not able to listen to our advice is that do one X-ray after getting relief of your complaints. Please come again with an X-ray. They do not want to listen this thing because it is cost effective. Then they have to come from a far distance. The moment the complaint goes up, they stop treatment. That was our concern. Otherwise, we
yes,
could correct much more number of cases.
yes. Fantastic sessions from both of you. We have got an opportunity to learn a lot regarding the maintaining of the data and how to participate. And
Chakma,
we'll encourage, and obviously it's the time to encourage all the youngsters to collect the data
sure.
and to process it and to publish it. Bidyut, are you there to conclude the session?
Um, Still, father's phone has been restarted, and for that, it is taking some time, and he is trying to join. Just give us
Okay,
5 more minutes,
Okay,
and
no problem.
here,
okay, okay,
I
okay.
guess here
Okay,
he comes. I guess here he
okay.
comes. Just taking few more minutes
Yeah,
to
yeah.
join to come up on
Today
the
also
screen.
I am having this tremendous problem of this Wi-Fi connection to this. What happens? I tried it from the clinic. It failed. I came to home, and there are some problem. This area probably has some problem with this. I do not know what happened.
This is a constant.
Sorry for
No, no,
network
that's all right.
snag and delay.
Sir.
Uh, we all enjoyed the session. I was going through the studio YouTube through my
Bidyut is trying to
in
join.
a laptop and
But
others.
okay.
It was so absorbing,
Yes.
sir, that I think of the 50 live viewers so far, none had any other question. I think people will go through it in the later stage and will be asking questions in the question means in the chat, direct chat in the YouTube. So
Yes.
it's our request to all the members, all the viewers across the globe to be present in the CME, be a speaker, be a moderator, or try to be the inaugurator at least, and share your experiences. We are really waiting for many new speakers to join us. And about the NIH online journal, NIH Alumni Association's online journal, SAPRE Audi, we are going to publish the second online edition by within next 2 weeks. And we request all of the alumni across the globe to be a contributory member with your articles, with your experiences, whatever your thoughts on the journal and on the activities of National Institute of Homeopathy. I thank Dr. Partha, Dr. Avijit. We had touched Bangladesh. This is the several times, but today we had touched another Bangladesh alumni as a inaugurator. I think Sumon will be there in future in the month of June or July as a speaker with us.
Very
And
nice.
our best, our best respect and pranam to Kalyani sir, who is taking all his pain to
Yes.
gather and make it updated for the online process. That's
No, it is
something
not my,
really astonishing.
it is my
A
pleasure.
person of
Most pleasure. Of course, it is
the
my
young
great pleasure.
people are not getting so much energy to prepare so many things for the next generation. But our evergreen Kalyani sir is doing all his work in his clinic after his clinic to get the things done as fast as practicable. Thank you all, sir. We are missing Pralay, Dr. Pralay Sharma. I think he is busy with some other works, but we thank all the people present. And in the coming days, we'll be having our 73rd online CME with one sole speaker, and we'll be having the concluding part of Kalyani sir's next episode in the upcoming CME, along with few other exciting speakers. And with permission from our president, not speaker tonight, Kalyani sir, we will be returning to the backstage editor now.
Sure. Thank you all,
Thank you,
and
sir.
good
Thank you,
night to
sir.
all of you.
Thank
Good
you,
luck.
sir.
Thank you, sir. Thank
Over
you,
to
sir.
you.
Good night, everyone.
Good night.
Thank you. Over to you,
Thank you.
Orko. Over to you, Orko. Again, technical snag in our area. I think Orko will be managing it accordingly.
Thank you all. Thanks for watching. I hope you have enjoyed today's CME, and make sure to like, share, and subscribe our channel, and also like this video. Share this with your fellow batchmates or fellow alumnus, whosoever you know, and also make sure to follow us on Instagram and like us on Facebook and Twitter. Also follow us on Twitter, and we are bringing up many more schemes for this thing, this CME program. We are bringing up and also restarting few more things in our upcoming days. So get ready for the surprises. Until then, so this CME was great, and we will be seeing you on our next CME. Until then, it's me, Orko Mukherjee, leaving, and time for some post CME talks. Bye bye. Good night to all the viewers.